I don't know. I feel like you just violated my face.
Okay. Rest, relax. There you go. Rest. That's it. We got it. All right. After 3, 1, 2, 3, and gas. Derek's the guinea pig today, and he's going to have some cranial facial release technique done. Now, the reason why I specifically said to you, and I messaged you, and I was like, Derek, you need to have this done, is because especially in like in the States and stuff, craniofacial release is becoming really big with NFL players, with boxers, people who have had a lot of impact to their head. It's something that's shown a lot of benefit for people who have had like post-concussion syndrome, people who have had blows to the head, and I know you've dodged all of those.
No,
Yeah.
Cameraman, show me the thing.
We take this little device, and what we do is we insert this into the nose.
Yeah.
Okay, I use a little stick just to help drive it into the nose. And then when it's into the nasal cavity, it goes into the nasopharynx, into the area deep in the face. And then what we're going to do is we're going to create a little pressure, okay, which is just going to pump the balloon up a little bit like that. And we're going to do it a few times. So it's going to increase in size when it goes down the back of your nose. And what this will do, it will open up and it will really stimulate and stretch out that area. So what this is going to do is actually going to stimulate, and it's going to actually expand that area. So what people often find when they have this done, number one of the first things they find is that their breathing becomes like clear. Okay, so for athletes and people like yourself who are like always looking for that extra edge, you know, hopefully this is something that can give you some benefit in that way. So I need to tell you a few things about this process that
might go wrong.
Okay, and you know, things that can happen. So sometimes what can happen is when we use the technique, the pressure can be quite strong, and it can sometimes cause a little nosebleed. It's not uncommon, but it can cause you to have a little bit of a nosebleed. Afterwards, you can sometimes feel as well that your maxilla, so the lower portion of your face, this can feel a little bit tingly, and it can feel like the bones around that area feel a little bit sore because it's actually going to be pushing on the top part of your palate. So it's going to be expanding from your nose all the way down into the top part of your palate. When I inflate the balloon, what will happen is you'll feel a pressure in the back of your face. You'll feel it in the back of your eye. It will feel a little bit uncomfortable for a minute. I'm going to need you to keep your hands down when we do that, because your immediate reaction will be to try and put your hands up to your face and kind of push me off or whatever. But what I'm going to need to do is, it literally, you'll feel that for a second and then it'll disappear. Okay. The pressure of the balloon will push into your nasal cavity, and it can sometimes go down into the throat. When the pressure goes down into the throat and the balloon comes down into the throat, that's actually when we know we've actually created the maximum amount of stimulation and the maximum amount of pressure in the cavity. And for that little millisecond, when we do that, you won't be able to breathe through your mouth at that point. So if the balloon does come into the mouth and you feel it in your throat, okay, I'm going to deflate it straight away. On some occasions, the balloon doesn't de-inflate, okay, and for that millisecond, you won't be able to breathe at that point. But I'll be using a pin to pop the balloon, and that'll resolve it. So if that happens, I need you to stay calm and chill. Don't like freak out and start panicking, and everything will be cool. How does that sound?
Oh, you just want to kill me, don't you? So this clears out the whole nose.
Yeah. Well, we'll like more on a level. What you're also going to probably feel within the next day or two is you might feel your sinuses releasing. So you literally feel like all of this muck and just sludge coming out of your nose. You'll feel like, you know when you're at the end of a cold and all those greenies and all stuff come out?
Everybody come see this.
Okay, and like I said, the worst part is just getting this in position. So nice and relaxed. Okay, relax the face as much as you can. Good. Okay, rest.
Yeah, see, motherfucker, shit.
Okay, good. All right, excellent.
Daddy,
Okay.
Yeah, so I'll get
That is good.
This nigga's trying to kill me.
Okay.
Daddy, he won't kill me.
Bro,
Okay, you
what are you doing, bro?
just tiny little pressure now. Okay, just as it seeds through.
Open your eyes, Daddy.
Okay. All right. Okay, Harari, I need you to just take a seat for me there for a second. Okay.
Alright,
After 3, 1, 2, 3.
No!
Okay, stop. Good. Perfect. Okay. Keep going.
Jesus Christ.
Okay, so that side we did properly. The first one, because you were kind of tensing up a bit, it didn't go down fully, but that one was like fully. That one was done fully.
I feel like this nose is blocked now.
Yeah, so we're gonna do that side again.
No, you ain't doing fuck all, man. It's my ass. I gotta do my fucking neck while we're at it. Come on.
Oh.
I don't know what you just did to my nose, bro, but you know what? I'm still trying to figure it out myself, but I feel great right now. I feel like both of my nostrils are firing up on great cylinders right now. But it's pretty frightening. It's a bit scary, but I enjoyed it. I think the more you do it, like you don't. Do you think you need that treatment once a year?
No, I need to give you the bad news, the bit I didn't tell you before.
Oh.
This is a treatment program. So to have the benefit of it, you've got to have a few of them done.
Oh. Thank God I got gates on my house.
Same time next week, yeah?
So how many times do you do, like back to back?
Ideally, you need to have 4 sessions so we can open up all of the cavities
Yeah?
properly.
Okay,
Yeah.
cool. I don't mind.
Normally, when I put it in, and to be honest, like yours was tight, which means your breathing space is tight. So you're going to see a lot of benefit from this, because if that opens up, you're going to feel the difference big time. But just giving you a heads up that those other cavities are going to be more uncomfortable, but the benefit is even more.
They made a condom for the nose.